So I think it's important for us to realize that AI tools have become more of like my savvy co-pilot, let's say my savvy clinical co-pilot, where it helps me sift through mountains of data, spotlights nuances that might have otherwise slipped past. I don't think it replaces the art of medicine. In fact, I could tell you it certainly doesn't. But it does, in some instances, sharpen my judgment. It allows me to focus more on the people who are behind those charts, while AI can handle some of the heavy lifting of pattern recognition and risk stratification. It's more like having a tireless assistant who's read every textbook and never sleeps, making my decisions, I think, at least in my clinical experience, making my decisions smarter, quicker, and ultimately more patient centered. Now, that is a very rosy, optimistic perspective, and I stand by it. But the thing with AI is that it's not 100%. I think it's going to get closer and closer. It'll never reach 100%. But the thing that I think is so important for clinicians to recognize in AI, and you have to use AI a lot to spot this, but there is AI slop. Okay, and you have to use AI a lot to spot the slop. I'm not trying to be cutesy there, but you have to use AI a lot to be able to recognize it. But minus the AI slop, which I think is I just in the year that I've been using AI, I would say it was like 30% when I first started using it. I would say now it's getting down to maybe like 10%, maybe 15%. So it's definitely made huge leaps and bounds. And I think that probably in the next year or so, it's going to be approaching. I don't. Again, it's never going to make 100%, but I think it's going to be getting closer to like in terms of accuracy, probably closer to 90, 92, 94%. I'm not. Let me also say I'm not an IT person. I'm an infectious disease guy, right? An epidemiologist, but somebody who does use AI a lot. So just are my 2 cents with that question, Rob. I think about this every day. I really, really do. And the first example I come up with is like what happens when the car first started rolling down the mean streets of Main Street, USA, when, all of a sudden you had guys that were like hammering horseshoes onto the feet of horses, that were no longer going to have a job, or carriage makers. Do you know what I'm saying? Like that's kind of where my head kind of goes. And I think about this all the time. And even when you and I kind of chatted a little earlier, like this is the one question that I think about a lot. And so the way I kind of have landed on it is that AI is, I think, less about replacing intuition. And I think it's more about refining it, right? And I think of it as like a seasoned mentor who never gets tired of reviewing cases with me. I think it enhances my clinical skills by providing deeper data insights and flagging possibilities that I might overlook. And I think that's so important. And maybe we'll come back to that in a moment. I think that my years of experience and judgment really ultimately remain the compass guiding final decisions. So rather than, I think, eroding intuition, I'd like to think that AI sharpens it. It allows me to be both more confident and curious in my diagnostic process. And Rob, I think it would be really interesting if you took a doctor. I'm mid career, right? I'm 27 years. What if you took a doctor who's 1 year out versus a doctor who's 40 years out? It would be really interesting to hear what their answers would be. And when I said let's put a pin in that pin that I wanted to put in was something that I think is so important because is that I do use AI to check my work to a certain degree in terms of differential diagnoses, in terms of making sure that I'm up to date on the literature and on recommendations. And I think that to me is some of the most important places where AI has really, really done an excellent job in refining my intuition. And the last example I'll give is this: is that I remember I'm old enough to remember when we had to go to the library to look stuff up versus when the internet came out. And I remember my mentors who, God bless them now, are, they were old then, 27, 30 years ago. They were probably 30 or 40 years ahead of me. So God bless them. Um, they were like, no, this internet thing is bad. You're going to lose your skills for how to look up and do research in a library. Right? I mean, that doesn't make sense by today's standards, right? And I think that that is what we are seeing right now. Like, it's ridiculous to go to the library to look something up. That was a skill that was appropriate pre-internet. That was an important skill. Don't get me wrong. You had to go to the medical library. Every hospital had one. That's where all the journals were kept, and you had to like know how to find what it was you were looking for. That's not a skill that is relevant in 2025. And I think that AI is going to do something very similar to that in 20 years. People are going to look back and say, like, you had to memorize the Krebs cycle. Why did you do that? Like, you could get a picture of it instantly on, using AI. So that's just kind of a few thoughts there. So again, another question I think about all the time because like I was mentioning in the previous answer, there is AI slop and you have to use AI to spot the slop. But that being said, I think that there is an element where trusting AI generated recommendations, you could think of it as like having like the smartest, the most brilliant advisor at the table. But at the end, the final decision still rests with me. And that's grounded in 27, 28 years of clinical experience and nuances in each patient's particular story. So while AI may help me spotlight possibilities and evidence that I might miss because I'm only human and I can only do so much of it, right? But if you weave that with, patient preferences and their values and the unique context, that's where the art, I think, of medicine, that is where the art of medicine truly shines. And it's a partnership with AI. It's not a handoff. And ensuring that technology informs care without ever overshadowing the human connection. And I think that's the most important part. So the way I think of this is that you got to think of AI as like a trusted wingman rather than a runaway pilot, right? I'd like to see mandatory clinician training on responsible use, along with regular audits for system accuracy, transparency, and bias. I think strong guardrails like clear documentation of algorithm logic, real time human oversight, and cross disciplinary ethics review. I think that will ensure that AI amplifies, not replaces the fundamentals of clinical expertise and patient centered judgment. In short, the best AI tools keep clinicians firmly in the captain's seat with technology as the co pilots and safety nets, not as autopilots. I think it's important for us to recognize that uh, that the regulation of AI is so incredibly important. And right now we're in the wild west of it where, I'm relying on my experience with AI to find that slop. But I would like to know that it is truly functioning as a co-pilot in the sense of assisting me and knowing that I can trust that information more than I already do now. And I think ultimately that we're going to get there. But to do so, we really need to have really, really, really strong regulation to be able to do that. Because what I am afraid of to a large degree are algorithms that can just start spinning off and either making stuff up or it's AI. I mean, it's let's put it this way. I don't know what I don't know. We don't know what we don't know. And who knows where this technology can go. And I think rather than letting it be that runaway train going down the mountain at, 250 miles an hour, we need to be able to pump brakes on it and control how we're going down that mountain rather than letting it just go free fall. And I think right now we're in a space where we are potentially in a free fall rather than in a very guided, deliberate fall, if that makes sense. For clinicians who are not using AI, I just want to say, again, it's like the internet. When, for those of us who were there when we were still going to the library versus when we were able to do online searches. And like I said in a previous answer, everybody gave me a hard time for losing my library research skills. And I was like, no, I need to learn new research skills, which is online researching. So please don't be afraid of AI. Start using it. How do you do it? You just got to open up, whatever Perplexity, Claude, ChatGPT. Right now, there's one that's called Open Evidence for anybody who hasn't seen. There's a very specific doctor, physician one that I think that is associated with JAMA and New England Journal. It's called Open Evidence. That's the one that doctors should be looking at. Use the other AIs as kind of like if you want to know directions, if you want to know the best, Netflix movie that's this week, that those are your AIs. That's where the Google searches is replacing Google searches. But open evidence, that's where you can ask very, very specific questions. And I do, and I lean on open evidence a lot in terms of asking very specific questions. If I have this patient, what's the likelihood of this? What would be the differential diagnosis or whatever? Start playing with it. Don't be afraid of it because it's here and it's here to stay and it's going to be changing very rapidly. And this is technology you definitely want to keep up with.